In this part of PowerPoint, we are going to focus about the restraint. So if your patient are harmful for themselves, or if your patient is harmful to the healthcare provider, or are harmful for other client or patient in some medical emergencies or condition, we has to put the restraint to the patient. Mhm. So definitely we do not put the restraint to abuse our patient, right? If need to put restraint, that scenarios we has to do this. But there are two type of restraint basically. One is called physical restraint, other is called chemical restraint, right? So physical and chemical restraint. So this is physical here, physical restraint and chemical restraint. So the physical restraint means like belt or vest, and chemical restraint means some sedatives or antipsychotic medication. So here you can see some picture. This is the type of restraint. Some physical and some are chemical restraint. Like tied up the patient with the wheelchair, or here the tied up with bed. Chemical, it is the physical restraint. And some chemical or psychiatric drugs are chemical restraint, right? This is the belt, is a physical restraint. So some book wrote the other type of restraint is called alternative. Alternative means you should reorientation your patient, or all the time supervision or diversion your patient concentration, right? So if we we should put the restraint, we has to keep something in mind. So before put the restraint, we must need doctor orders, right? I said we must need the doctor orders. That number one, we need the doctor order. Number two, we need the renew the every 24-hour the physician order, every 24-hour renew it. And also only RN can put the restraint, only RN can put. And number three, I said every 24-hour we need to renew the doctor order, right? So there's some note also we has to keep in mind if a patient need to put the restraint. So in an emergencies, the RN can place a patient in restraint, but must get the prescription from doctor within 1 hour. The orders can be written for up to 4 hours for adult, and remove the each restraint once at a time every 2 hours. And we has to assess the skin integrity, neurovascular check, and provide the ROM exercise. right? Motion exercise. And neurovascular check means we should check the blood supply, we have to check the nerve supply, and also skin integrities, right? We should check. So also apply the restraint so 2 fingers can fit between the restraint and patient. And also we use the quick release knot. It is important, we have to know. So after the put the restraint, we has to keep the charting. So when we make the chart, we write details. We write the details. What we should write about the restraint, we has to write at least some point. Means one is the type of restraint. What type of restraint we use? Is it chemical or it is physical? Then why I put restraint? Reason, right? We has to put the reason. Why? Also the location. Location means where I put the restraint, upper extremity, lower extremity, or any other part of the body. And also we have to keep in chart the duration of restraint, right? So when you make the document or charting, you have to write details. Why, what are the reason, what are the type, location, and duration of the restraint. Same time, keep in mind if any incidents occur, we have to keep a note as well. So if the patient is the psychiatric problem, if the patient need the restraint, that times keep in mind if the patient has a seizure, do not restrain the time of seizure, never. And also keep in mind if patient have a seizure, do not put anything in mouth or place the patient in lateral position. Give them oxygen and put the bed in low posture. Also, bed rail on beside of the bed. So this is showing different restraint. The restraint on hand. This is the restraint with wheelchair. This is the belt restraint over the wrist, right? Belt restraint. And this is picture showing the chemical restraint. Now go some talk and I read about this. Use of restraint. Restraint should never be used as a punishment or for convincing the healthcare staff. Let me give you some example. Like I have a night duty. I give some extra sedative to my patient. Patient will sleep, I will sleep too. So it is abuse. We do not do this. So I said the sedative or antipsychotic medication are the chemical restraint. For my better sleep, I do not give extra sedative to my patient. Another example, like my patient do not want to eat dinner or lunch. I said, if you do not eat, I am going to put the physical restraint your hand. This is punishment type of threat, right? So restraint are used when behavior is physically harmful to the client or others, or even alternative or less restrictive measures are insufficient in protecting the client or other from harm. An alternative, I said, sometime we try not to put restraint, try to reorientation, supervision, and diversion their concentration. The nurse must document the behavior leading to the use of restraint. So I said we have to write why I'm going to put the restraint, what type, where, and how long, right? Definitely need doctor order. If I take the doctor order over the phone like midnight, another RN must be there. Need 2 RN, right? Nurse must document and restraint use when the client anticipate that a control environment would be helpful or request to put. In emergencies, the qualified nurse may place a client in restraint. So RN can do it, never LPN, right? So within 1 hour of initiating a restraint, the psychiatrist must make a face-to-face assessment. So I said always need doctor order, but in any condition, if RN should put the restraint, still they need doctor order over the phone, but within few hours, doctor must come physically. I mean within 1 hour. Even order need to renew every 24 hours by physician. So here I said within 1 hour, right? Initiation, we have to check, or while in restraint, the client must be protected from all sorts of harm by having one-to-one supervision, super important for NCLEX. The client in restraint needs to constant one-to-one supervision. And also, I told you, and remove each restraint once at a time every 2 hours. And we have to assess the skin integrity, neovascular check, means blood supply, nerve supply, or any other local change. Also provide some motion exercise, right? So physical safety need must be assessed every 15 to 30 minutes. And this observation can also document it. The nurses must always follow the agency protocol and policies regarding the use of restraint, and must also be familiar with their use for older client or juvenile client, like young patient. So we should keep in mind one more point. When need to apply the restraint, so 2 fingers can fit between restraint and patient, and always use quick release knot, okay, NOT, quick release knot, right? This is the very basic information we have to need for NCLEX board exam.